My first symptom on my AFib was on an airplane. Got really scared and nervous. Asked the flight attendant if she could find quietly if there was a doctor, on board. My name is Sam Choy. I'm 67 years old. I've been an executive chef for 40 years. I live in Kona with my wife and my 4 dogs, and we have 2 sons and 3 grandchildren. I'm passionate about making people happy, cooking, deep sea fishing, and I write a lot of cookbooks, and my cooking show, which is a real amazing show, Sam Choy's in the Kitchen, where we go in people's homes and take their leftovers and create wow menus. Every day is different. I'm constantly on a run, I'm moving. I was on a flight flying back home to Hawaii, and all of a sudden, I just felt really, really weird. Like my heart was really racing. And when I landed, I called my doctor, and he told me go straight to an emergency right away. And so I got to emergency, and then boom, they found out, I had an AFib going. I got prescribed really quick a blood thinner. They tried to make sure that I would not get into that position of maybe a stroke. My next journey was to see a cardiologist who then, checked it all out. And I ran a couple of tests, and he said, okay, nope, you don't need a plumber. You need an electrician. And that's where Dr. David Singh came in.
My name is David Singh. I'm an electrophysiologist in Honolulu. So an electrophysiologist is a cardiologist that has done additional training to learn how to treat electrical disorders of the heart. Often this means that we do procedures called ablations, where we go into the heart, find the electrical disorder, and ultimately hope to get rid of it so patients can improve their lives. Sam was referred to me by a colleague who told me that this very famous chef, Sam Choy, had atrial fibrillation. What really struck me was just how patient he was in listening to all the different options in terms of management. I went through all the different elements of AFib, the different kinds of management strategies, and in the end, I think he came to a good understanding of what the best pathway for him was. For Sam, I decided to use radio frequency ablation, which is a technology that allows me to go into the heart and inactivate areas of the heart that are causing AFib.
He called me on the phone and he said everything went well. I felt good, really good, That was really amazing. Like a blessing, actually.
Since the ablation, Sam has been doing great. He's remained in sinus rhythm. His heart has been totally steady. He's had no symptoms, and he's feeling much, much better. His quality of life has been restored to what it was before he even had AFib.
After the ablation, I lost over 35 to 40 pounds. I feel good physically, mentally. I think if I didn't have the procedure, I think I would be working at a half speed.
My advice for patients that have atrial fibrillation is to ask their primary care doctor or cardiologist to refer them to an electrophysiologist. Just knowing what your options are as a patient is incredibly important. But most importantly, Sam has been able to do the things that he was doing before he developed AFib, traveling, fishing in the deep sea, and teaching the world how to cook.